All right. Welcome in, everyone. Thank you so much for joining us for March's virtual support group. So today we are talking about Medicare 101, and I have the pleasure of having Mr. Patrick Birch here today to talk to you all. He is an AARP volunteer and a certified SHIP counselor, and he will be running you through the basics of Medicare and the different plans, or the different parts, rather. And so just a few housekeeping things before I turn it over to Mr. Birch here. We will be recording today's session, as you might have already noticed, and then it will be available on YouTube later this week. And also we will have our Q&A session at the end of today's session. So if you have any questions throughout today's session, feel free to use the chat box function as a parking lot for all questions, and we will answer those at the end. But without further ado, I would like to turn it over to Mr. Birch here. Thank you all for being here.
Thank you, Kiana. Hello and welcome to everyone. My name is, as Kiana said, my name is Pat Birch, and I'm a volunteer with AARP here in the Triad region of North Carolina. Originally from Maryland, I've been in North Carolina since 1992. Most recently moved to Greensboro, where my wife and I have two of our three kids with grandkids here. So we've been certainly enjoying being close to them. My adult work life spanned two careers, one in education and one in insurance. But since that time, since 2015, I have been a volunteer, active volunteer with the North Carolina Senior Health Insurance Information Program, commonly known in North Carolina as SHIP, that's SHIIP. And I've been an active counselor certified with them, and more recently became active with the AARP here in the Triad region. In both those volunteer roles, my focus has been primarily on helping people better understand Medicare and the benefits associated with it. So I look forward to this afternoon session with you, and hope that you get a lot of good information from being a part of this session. Just like before we get started, I just want to mention that as a counselor, I cannot provide personal information or advice to you, in a setting like this. But if you have questions or concerns about Medicare, specific questions that we can't get to today or don't have time to get to today, I'll be glad to ask Kiana to pass along my information to you, and you can contact me, and I will give you a call and try to help you with your personal situation at that time. So just keep that in mind as we go along. I'm going to, so that I can see my whole screen, I'm going to minimize my window there. And so we're looking at Medicare 101, understanding your benefits. I want to take a moment just to review our topics of discussion today. We're going to talk about the basics of Medicare. Many of you know that as the Medicare alphabet, A, B, C, and D. So we're going to overview those different parts of Medicare, what each of them cover, and what the costs are for 2024. And then we're going to take a look at Medicare choices. As people turn 65, as they approach eligibility for Medicare, what are the choices that they have in front of them? What decisions do they need to make? So we'll spend some time on that. And then we'll spend, so I think Medicare fraud, a little bit of information about Medicare fraud and what beneficiaries can do to protect themselves and help Medicare deal with Medicare fraud. And then finally, I think it's important for Medicare beneficiaries to realize that they're not in this alone. There are tools out there, there are resources out there that they can turn to, they have access to, whether it be people like me, counselors in the local area, or online resources and tools. So we'll talk about those things that are available to most people, where they can go and get more information. With that in mind, let's get right to the basics. What is Medicare? Well, just a brief history lesson. This summer, this July, Medicare will turn 59 years old. It's hard to believe. We go back to July of 1965, when Congress amended the Social Security Act, adding Title 18, which created health insurance for people 65 and older, regardless of income and regardless of health. So original Medicare really goes back to 1965. That's original Medicare A and B. And it wasn't until 30 years later, in the mid-90s, where Medicare Part C, Congress again amended the Social Security Act to create Part C of Medicare, which is commonly referred to today as Medicare Advantage. And that allowed private insurance companies to enter the market and to offer health coverage plans to seniors. So Medicare then is a federal health insurance program for individuals. Focus on the word individuals there. There's no family plans or spouse coverage or group coverage. Each person, when they turn 65, they're individually eligible, for Medicare, and they have to sign up. It covers, obviously, covers age 65 and older, for some younger people with certain disabilities, and also for people with permanent disabilities like end-stage renal disease and people with ALS, which is also referred to as Lou Gehrig's disease. So again, original Medicare Parts A and B, and then Medicare Part C became part of the law in the mid-1990s. And then finally, Part D became part of Medicare in 2006, 2007 timeframe. And Medicare Part D offers prescription drug coverage for Medicare beneficiaries that are on prescription drugs. So we're going to talk about all those different parts and what they cover momentarily. Before we begin, like most insurance, Medicare does not pay for all of our health coverage costs. We are, the beneficiaries, are responsible for paying some of the costs that are not covered. And these, what we're talking about here, are things like the monthly premium, deductibles, co-insurance, and co-payments. Those are terms that most of us are familiar with because they're associated with just about all different types of insurance. But everybody pays, just about everyone pays a monthly premium for Medicare or private insurance. Deductible is obviously the amount we owe before the healthcare services, kick in and begin to pay their share. So the deductible may or may not apply to all services, but it is a flat dollar amount typically. Co-insurance is the amount that you may be required to pay as your share of costs for services after the deductible has been paid. And oftentimes the co-insurance is a percentage. For example, original Medicare is typically referred to as an 80-20 plan. So Medicare will cover 80% of the approved medical services, and the beneficiary under original Medicare would be responsible for the 20%. And then co-payment, the final box here, responsibility, is a fixed amount that we pay for a covered health service, usually when you receive that service. A good example would be a copay for an office visit. Could range anywhere from $0 to $25 for a primary care visit, or for anywhere from maybe $0 to $50 for a specialist visit. So that would be what would be considered a copayment. So just wanted to get everyone familiar with these terms, because they're going to, whether you're talking about Medicare A, B, C, or D, these terms will apply to the individual. I think it's important that we focus on the next couple of slides before we go any further. And that's the realization, like most insurance, Medicare does not cover everything. For example, Medicare does not pay for vision, does not pay for dental care in most cases, hearing or long-term care such as extended stay in a nursing home. Some Medicare Advantage plans may cover these, but traditional or original Medicare does not. We will get into the differences between original Medicare and Medicare Advantage a little bit later on. But the fact that Medicare does not cover long-term care services is a surprise to a lot of people. So Medicare only helps cover certain services if they are medically necessary. And it does not cover custodial care, help with activities of daily living, for example, such as bathing or eating or dressing or using the bathroom. The Medicare also does not cover vision, but there are exceptions. For example, cataracts and glaucoma are covered, as well as some surgery for chronic eye conditions. And if you're diabetic, Medicare covers annual eye exams by Medicare authorized or Medicare approved eye doctors to check for diabetes related vision problems. Dental care is not covered in most cases, and hearing aids or hearing fitting appointments, none of those currently are covered by Medicare. And also foreign travel. And by foreign travel, we mean travel outside of the United States, which is the 50 states, the District of Columbia, and its territorial possessions of the U.S. Okay. Now there are some exceptions to these to the travel rule. For example, even under Medicare Part B, but typically foreign travel is excluded under Medicare coverage under original Medicare. Medicare does not pay for stay in any long-term care facilities or the cost of any custodial care that we mentioned a moment ago, except for very limited circumstances when a person receives home health services through a Medicare-approved agency, like a skilled nursing facility. Please note that these rules are complicated, and we're just going to go over them at a very high level here. In a skilled nursing facility, what does Medicare cover? Well, if you're enrolled in original Medicare, Medicare Part A can pay a portion of the cost for up to 100 days per benefit period in a skilled nursing facility. If you can, as long as you continue to meet Medicare's requirements under specific limited circumstances. For example, the daily skilled nursing or rehabilitative care has to be ordered by a physician, and the care cannot just be custodial. That is, it cannot just be personal care like bathing and dressing. It has to be some skill care involved. And you must be admitted to a Medicare qualified skilled nursing facility within 30 days of a qualifying hospital stay for the same illness or injury or a condition related to it. Qualifying hospital stays means that you must have been admitted as an inpatient for at least 3 consecutive days in a hospital. Observation status does not count as one of those 3 days, but the day that you are admitted does count, but the day you're discharged does not count as one of the days. So additionally, any time spent in an ER does not count. So we just need to be sensitive to what the rules are regarding being an inpatient and having at least 3 consecutive days in a hospital before Medicare will approve care in a skilled nursing facility. Now, what do we pay? Let's talk about that for a moment. If you qualify for coverage in a skilled nursing facility, Medicare pays 100% of the cost. That would include meals, nursing care, room, etc., for the first 20 days. For days 21 through 100, you would bear the cost of a daily co-insurance, which we'll review in a moment. And then anytime day 21 to 100, there's a copay. And then if you're in that facility for longer than 100 days, then you pay all costs associated with that. Now that we've talked a little bit about overviewing Medicare and how it works and some of the things it doesn't cover, let's talk about some of the things it does cover and learn more about the different parts of Medicare. So, as you know, we've already talked about the Medicare alphabet, the A, B, C, and D. So and over these next several slides, we're going to break Medicare down into its different parts. As you can see on this screen, Medicare parts A, hospital, B refers to medical or doctor care, and that's under original Medicare. So Parts A is hospital, Part B medical. Part D is optional. Part D, of course, refers to the provision that allows people to enroll in individual standalone prescription drug plans. You may have also have heard about Medigap or Medicare supplement plans. These plans, they are supplemental insurance for those people that are on original or traditional Medicare. We'll talk a little bit about that in a moment. So A, B, and D makes up original Medicare, and that's that dark triangle you see right there in the middle of the screen. Then we look to the right, the larger triangle, Medicare Part C. Part C of Medicare, known as Medicare Advantage. These are plans that are offered by private insurance companies approved by Medicare, and they include hospital, doctor, as well as prescription drugs. So the two options out there are basically original Medicare and Medicare Part C or Medicare Advantage, and they all contain A, B, C, and D. Okay, well, A, B, and D for original Medicare, A, B, and C for Medicare Advantage. Now, Part A of original Medicare is often referred to as hospital insurance. And you can see that by hospital insurance, it helps cover inpatient hospital care, some home health insurance, hospice care, some skilled nursing facility care. That's Part A of Medicare. Let's talk a little bit about the cost of Part A. Most people who qualify for Medicare do not pay a premium for Part A because they've already paid for it through payroll FICA taxes during their working careers. If you do not have Medicare Part B, it's possible to buy into it under certain circumstances. But most people qualify because they're eligible. They've worked at least 40 quarters or 10 years, and they've paid FICA taxes for that length of time. Part A of Medicare has co-insurance as well as deductibles. Those are the terms we were talking about earlier. There is a deductible in 2024, $1,632 for inpatient cost for each benefit period. The benefit period ends when you have not received any inpatient hospital care for at least 60 days in a row. Let me just comment on this for a moment. The term benefit period is unique to Medicare. It's their way of measuring hospital usage. So it's possible if you're in the hospital for 3, 4 days, 5 days, you get out, you'll be responsible for that $1,600 deductible, even though when you went in the hospital in that very first benefit period. And then you're out of the hospital, say you're out of the hospital for 60 consecutive days, and you go in the hospital after that period of time for either the same condition or something totally different, you begin a new benefit period, and therefore you'd be subject to people on original Medicare with Part A would be subject to paying that deductible amount a second time in the same calendar year. So just keep that in mind because that's unique to original Medicare. In addition to the deductible, Part A also has co-insurance. After you've satisfied your deductible, you have no co-insurance for the first 60 days of a hospital stay in that benefit period. So you have zero copay there. But if you go beyond, if that benefit period extends beyond day 60 and you go 60 to 90 days, you have a co-insurance obligation of $408 per day during that 61 to 90 day period. And if you go beyond the 90-day period, there are what's called 60 lifetime reserve days in Medicare, where your copay would be $816 per day. So if you have 60 lifetime reserve days, once those are used, you would pay the full cost of care beyond that time. This is just a general overview of Part A cost. For more detail, we would always recommend that you go to Medicare.gov. There's a lot more information there and a tremendous resource to help us get more information about these various parts of Medicare. Medicare Part B. So we have A, hospital. B is anything outside the hospital, basically medical insurance, which covers medically necessary and or preventive services. So medically necessary is what's important there. Now, medically necessary services and or supplies that are needed to diagnose or treat a medical condition that meet accepted standards of medical practice. This would include things like doctor visits, and even today, like e-visits, still Medicare provides coverage there. Outpatient hospital services such as x-rays, same-day surgery, durable medical equipment, wheelchairs, walkers, hospital beds, mental health services, rehab services, and Medicare-approved preventive services. By that, we mean care to prevent illness, like the flu, for example, or to detect illness at an early stage when treatment is most likely to work best. This could include tests, screenings, and wellness visits and assessments. And there's an extensive list of preventive services that can be found at Medicare.gov that all Medicare beneficiaries are eligible for. They just need to be aware. And as long as they are using a physician that accepts Medicare assignment, they will have zero out-of-pocket costs for that preventive service. Medicare will cover that. The other thing to keep in mind when we talk about cost, and we mentioned this a little bit earlier, for medically necessary services, remember we said Medicare was an 80-20 coinsurance plan concept. So typically, Part B services are 20% of those services are going to be responsible. You're going to be responsible for that, or at least the Medicare beneficiary would be for any Part B services after they've met the deductible. Now let's look at Part B costs for 2024. These took effect January 1 of this year. If you are enrolling in Medicare in 2024, the standard premium is $174.70 per month. Now, some people, those with higher incomes and individuals earning more than $103,000 a year, or couples earning more than $206,000 a year, they will pay a higher premium based on their income. And then the other thing is the deductible, the annual deductible for Part B this year is $240, and then coinsurance, like we just mentioned, is 20% for most services. Now, let me mention this point. If you do not sign up for Part B when you are first eligible, it's possible that you could face what's called a late enrollment penalty when you do sign up. And we'll talk a little bit about that in a second, but typically people that are working beyond age 65 and they have group health insurance will typically not enroll in Medicare Part B because they're covered under their spouse employer work group plan. Or if their employer has 20 or more employees, they can continue to work and their employer coverage would be primary. They would not need to enroll in Medicare Part B at that time. But when they choose to retire, that's the time they need to plan, several months in advance of that so that they can complete the enrollment process for Medicare Part B. And we'll talk a little bit about that on a later slide. Just keep that in mind. So we've got A and B under Original Medicare. Now, the next part of Original Medicare is Part D, and this is the newest part. It became part of the law in 2006, 2007 timeframe, and it's been evolving over the past, 10, 15 years to what it is today. But Part D is Medicare prescription drug coverage. It helps cover some of the cost of prescription drugs that beneficiaries pick up at the pharmacy. I'd like to just put a plug in here. This is such an important issue for Medicare beneficiaries. Recently, AARP led the fight to lower prescription drug costs. Uh, Millions of older Americans, as we all know, will now save money on medications. The new law caps Part D prescription drugs beginning in 2025. So starting next year, that's when it will really kick in. Beneficiaries, if assuming it's being challenged in court now, but assuming Medicare is successful in court, starting in January 2025, beneficiaries will not have to pay more than $2,000 a year for prescription drugs. Drug makers who increase the price of a drug more than the rate of inflation will be penalized. The law also caps the out-of-pocket insulin is $35 a month, and that started actually in January of last year. So that benefit's already out there for folks that are on insulin, people with diabetes. So that one's already in place. So it's capped the cost of insulin at $35 a month, and out-of-pocket costs for most vaccines now under Medicare will be eliminated, have been eliminated. You can get those as part of the part of Medicare Part B, preventive services. So Part D plans are run by Medicare-approved private insurance companies. So to get Medicare prescription drug coverage, you must join a plan run by an insurance company that's been approved by Medicare and abides by Medicare rules and regulations. If you are eligible to join, but do not when you are eligible, there could be a late enrollment penalty. Qualified drug plans may be included in some retiree insurance plans, and they may meet Part D requirement. What that means is basically there are drug plans that are out there either as part of a retiree plan or maybe military plans like VAs have. The VA offers drug coverage. So certain people in the population may already have credible drug coverage and not have to purchase a Part D drug plan under Medicare because it's credible coverage. But each case has to be looked at individually. But generally, most people, it's optional. Yes, you don't have to enroll, but if you choose not to enroll and then later on decide to enroll, you may be subject to a late enrollment penalty. So that's something to keep in mind. If each year these drug plans will send out annual notices of change, usually around August or September of each year. And these include changes to the cost of drugs in their plan, cost of any premiums, and changes in any pharmacy networks. So these, they're called ANOCs, annual notices of change, and you want to review those each year because if the medication you're on in that drug plan's formulary is changing, maybe switching from tier 3 to tier 4 or 5, or your pharmacy is no longer a preferred pharmacy, all those things will impact the cost of medication. So you want to keep an eye out. If you're on a Part D plan, keep an eye out every fall for the annual notice of change. And also, they are required to keep a formulary. If you're on regular medication, these drug plans have a formulary, and all the medications that they cover are on that formulary. And you want to make sure that the medications you're on, that you're taking regularly, are still on that drug plan going into the following year. Otherwise, you'll wind up staying in the drug plan if you don't change it and wind up having to pay more for your medications. So that's very important. So you want to consider selecting plans, based on your not only cost, but whether or not the medications are covered. Let's take a look at cost for Medicare Part D. Go back here. Prescription costs 2024, Part D. The benefits and costs vary among plans. There's typically a monthly premium, copays, deductibles associated with Part D, just like Part A and Part B, and also Part C, unless you qualify for assistance paying for these costs. And there are programs available to help people that qualify based on need. As with Part A, premiums for Part D are higher for individuals earning more than $103,000 a year, or couples earning more than 206,000. So that's the same thing there. The deductible in 2024, the highest deductible that Medicare has approved is $545. That's an annual deductible. Many plans, or some plans, have less deductibles. In fact, if there are several plans that have a zero deductible, but in that case, the monthly premium is higher than typical. Okay, so the deductible is $545. The other part of Part D plans, perhaps you've heard of the concept of the donut hole. Uh, the donut hole refers to a coverage gap in a Medicare drug plan, but it's since 2020, it technically it has closed over the last few years. Based on what we've seen so far, cost sharing may still increase once you reach it. Once you reach what's called, it's no longer called the donut hole, but the coverage gap now. These Medicare Part D plans have 4 phases to them. One is the deductible phase, and then the initial phase, and then the coverage gap, and then the catastrophic. So we're talking about, based on what we've seen so far, cost sharing will still may increase once you reach the coverage, but typically the cost is going to be about 25% once you reach the coverage gap. In 2024, once you've had total out-of-pocket costs of $5,030, now that's not out of the beneficiary's pocket. That's only 25% of that's going to come out of the beneficiary's pocket. The rest of it's going to be picked up by the plan, the drug plan itself, and or a third party, which is usually Medicare. But once you reach that, starting January of this year, once you reach the total out-of-pocket cost between 5,000 and 8,000 is called the coverage gap. Once you reach 8,000, you move into catastrophic level, and then you pay zero for the rest of the year. Now, a small percentage of people will fall into that category. Most people on a drug plan, based on statistics that Medicare provides, most people are not going to even enter the coverage gap of $5,000. So they're just going to wind up paying the monthly premium for the drug plan, whatever their deductible is, and then 25%. And they'll finish probably somewhere under $5,000 for the year. And even if they reach the $5,000 coverage gap figure, keep in mind that they're only paying 25% of that figure, so it's going to be quite a bit different than that. And if they reach the $8,000 figure, they're going to only be paying 25% of that, because Medicare and the drug plan would have picked up the difference at that point. So just putting a 25% figure to that, so maximum out of pocket is $2,000. And that's the way it's going to be starting in January 2025, assuming that law continues and Medicare wins the court battle, where the maximum out of pocket starting in January of 2025 will just be the $2,000 plus the premium that you pay. The premium does not count toward that maximum out of pocket. Let's take a look now at what we call Medicare choices. We just looked at the different parts of Medicare in the previous slides. Let's take a moment now to imagine you're turning 65, you're planning what decisions you make, what choices do you have to make. You basically have two major choices, two main options to get health coverage through Medicare. It's either original Medicare, A, B, and D if you choose to enroll. So that's original Medicare, or Medicare Advantage Part C, which is A, B, and D. And you can get Medicare Advantage plans that do not bundle prescription drugs. That they come without a Part D plan if you already have credible drug coverage. So the choices you basically have, though, are just, do I want original Medicare, or do I want to go with Medicare Advantage? Let's take a look at what original Medicare, how that works. Original Medicare is described as a fee for service. That's a method in which doctors and providers are paid for each service that they perform. It includes A and B, hospital and medical, as we talked about a moment ago. You can go to any provider that accepts Medicare, and this is one of the things that's very appealing to a lot of people. The fact that they can keep the doctors that perhaps they've developed a relationship with over the years, as long as that doctor takes Medicare assignment, and most doctors do, they can stay with that doctor. Even if they travel, they don't have to, Medicare is going to be accepted generally wherever they travel in the country. And then D, they can choose and join a Medicare prescription drug plan for drug coverage. So in general, original Medicare pays 80% of your covered medical cost after you've met your deductible. And remember, each Medicare A has a deductible as well as B. Because Medicare does not cover all your health care costs, some people consider buying a Medigap policy or a Medicare supplement plan. You can only get a Medigap policy if you have original Medicare. It's not legal for an insurance agent to sell in North Carolina and in most states or try to sell a Medicare Advantage plan to anybody that's on I'm sorry, not to sell a Medicare supplement plan to anyone that's on Medicare Advantage. You can only have a supplement if you're enrolled in original Medicare. People with original Medicare can go to any doctor or hospital or healthcare provider who accepts Medicare. And as I said, if you enroll in original Medicare, you can choose to enroll in a Part D prescription drug plan. Let's talk a little bit about Medigap coverage or Medicare supplement plans. Because Medicare doesn't cover all costs, as we know, some people elect to purchase Medicare supplement plans, sometimes referred to as Medigap plans. Medigap is a private health insurance plan that helps pay for health care services that original Medicare doesn't cover, such as deductibles, co-insurance, and co-payments. So it fills the gaps there where it doesn't come out, where the Medigap plan will step in and pick up those costs for you. And as I said, it's only available to people with original or traditional Medicare. Insurance companies in most states offer up to 8 standard plans for new enrollees, and each one offers a different level of benefits to help fill in the different gaps in financial coverage and varies in price. So there is a monthly premium associated with this. The only thing you'd be responsible for would be that monthly premium and perhaps any deductibles. So let's take a look at the process of enrolling in a Medigap plan. Individuals can purchase a Medigap policy within 6 months of enrolling in Part B. Now, keep that in mind, within 6 months of enrolling Part B. If you forget to enroll during this time period, that 6-month period is basically a guaranteed issue window. So whatever month, the first of the month that your Part B is effective, you have a 6-month window from that time to enroll in a Medicare supplement plan without being asked any health questions. If you forget to enroll during this period, you decide to enroll, say, 7 or 8 months later, the insurance company may be able to deny you coverage or charge you more, or even or put a stipulation on the policy saying they wouldn't provide coverage for, say, 6 months for that particular condition. So it's important, if you choose Medicare Advantage, if that's your choice rather than original Medicare, none of this applies to you. You cannot get a Medigap coverage plan with Medicare Advantage. So you would pay a monthly premium for a Medigap plan. Let's go. So we've covered Medicare, original Medicare, the choices there, A and B and D, and Medigap or Medicare supplements. So let's put that aside for a moment. Let's go to Medicare Part C, which which has been a part of Medicare since 1996. So it's been evolving. It's got quite its own history. So let's talk about that choice. Let's say you choose Medicare Advantage as your coverage as you're enrolling in Medicare. As mentioned earlier, they're also known as Part C Medicare. They are plans that are private health plans offered as alternative to original Medicare. That's what that letter C stands for. Stands for choice. People wanted a choice between original Medicare run by the federal government and private health insurance plans. So Part C it gave people that choice. That's where Medicare Advantage came in. To be eligible for Medicare Part C, you must first enroll in original Medicare A and B. So you've got to have A and B to enroll in Medicare Advantage or Part C. You will continue paying your Part B premium. Remember, this year it's $174.70. You'll continue to pay that premium. And some Medicare Advantage plans may also charge an additional monthly premium. Many don't, but some, depending on the plan that you choose to enroll in. All Medicare Advantage plans must include Part A and Part B, and in most cases, they will include drug coverage, which is Medicare Part D. So they're bundled. You get hospital and doctor or medical and drugs all in one plan, as opposed to being different parts. As mentioned in the last section, be aware that if you choose Medicare Advantage plan, remember that 6-month window. If you choose to enroll in a Medicare Advantage plan instead of original Medicare with a Medigap, your ability to switch later on can be limited by that. There are people under Medicare rules, certain times of the year, and we'll talk about this in a couple of slides, there are open enrollment periods where you can make changes to plans. If you don't like a Medicare Advantage plan, you can switch to another, or you can switch back or switch to original Medicare. But once you've gone past that 6-month window when you enrolled in Part B and you wanted to switch to original Medicare, you may not be able to get a Medigap plan at that point because you're beyond that 6-month window that we were talking about. So just keep that in mind. Now, what does it cover? What does Medicare coverage? Well, pretty much what we said earlier. It includes Part A, which is hospital, Part B, which is medical. That's all included in the plan. Some plans may also include Part D, Medicare. Now, there may be some deductibles, but depends on the plan. And some plans will offer extra benefits. I'm sure we've all heard about some of the Medicare Advantage plans out there that offer benefits, for example, for certain dental benefits, hearing and vision exams, depending on what you may select. And there may be costs associated with those extra benefits, but they are being offered under some Medicare Advantage plans. One of the regulations that's in place regarding Medicare Advantage is that everything that they offer, they have to cover everything that Medicare offers, or whatever. They have to cover everything that original Medicare offers, plus they can add benefits. And that's where as long as they're equal to or a little better than Medicare. So that's where these extra benefits come in, like dental or hearing or vision exams. Let's take how it works. It's a little bit different. Medicare Advantage plans, of course, are available throughout most of the country, throughout all of the United States. But you must live in the planned service area to receive services. That's a little different than Medicare. Medicare covers all 50 states. You can go anywhere, try it within states anyway. You've got coverage as long as the doctors take Medicare assignment. But under Medicare Advantage plans, you must live in the planned service areas. You must choose from the plans available in your area, and you must sign up directly. That means you'd have to contact the plan to sign up, or if you were working with an insurance agent that would sign you up, you'd have to sign up directly. Medicare Advantage plans pay for the same health care services as original Medicare, but they also might pay for additional benefits. We mentioned that already. In most Medicare Advantage plans, you can only go to doctors or specialists and hospitals on the plan's provider list. That's a little different than Medicare. Plans may limit coverage or provide no coverage for out-of-network providers. We've all heard those stories where people needed medical attention. They were away from home, maybe within state or out of state traveling, and they wound up not knowing or unknowingly going to a provider that was not on their network and got stuck with some high hospital bills. So you have to be careful with that. If it's an emergency, that's not possible. So you want to be careful to follow the insurance company's rules requiring referrals to see a specialist. And you may have to use, to get the best, to follow the rules, you may have to use a specialist within their network. So these are rules and guidelines specific to Medicare Advantage plans. If you have a Medicare Advantage plan, your out-of-pocket costs are going to depend on a number of things. For example, whether the plan charges a monthly premium in addition to your Part B premium, and some plans do. Some plans charge an additional premium for your Part D coverage if you have a Medicare Advantage plan with drug coverage, but some plans don't. So you have to be careful to review the plans to make sure that you understand how they work. Whether or not the plan has yearly deductibles or additional deductibles, whether you can follow the plan's rules, like using providers in the network, how extensive it is the network. If you live in the eastern part of North Carolina, how extensive is that network compared to, say, the metropolitan areas like Charlotte or Raleigh? Whether you follow the plan's rules, like using providers in the network. Seeking services outside the plan's network of providers, you're likely to have more, to pay more. And then finally, whether you need extra benefits and if the plan charges for them. So keep this in mind. All these amounts are determined by the insurance company that runs the Advantage plans. And so costs will vary depending on the plan, and they may change each year on January 1. Okay. So we've touched on original Medicare basics and the choices between original Medicare and Medicare Advantage. Next question, this topic, pretty interesting, get asked this question a lot. How do we enroll in Medicare? Well, if you are receiving, but we're talking about initial enrollment, for most people, if you are already receiving Social Security at age 65, you will automatically be enrolled in both Parts A and B. If you're not already enrolled in Social Security, you'll have to enroll in Medicare. There's a 7-month window, 3 months before your birth month and 3 months after. So that's a total of 7 months. If you don't enroll in Parts B and D when you're eligible, it's possible that you could face penalties, late enrollment penalties later on when you do enroll. So you want to at least understand what those timelines are. And again, keep in mind, one exception to this is if you have coverage through your employer or your spouse's employer through a company with more than 20 employees, you would be exempt from, and you decided to continue to remain, to keep your coverage with that employer, you will not be subject to a late enrollment penalty when you do enroll in Medicare. So just keep those points in mind. Changes. There are certain times of the year when people with Medicare can make changes. Go over these. Medicare, the first open enrollment period, Medicare drug coverage from October 15th to December 7th each year. You can join, switch, or drop a plan. Your coverage begins the following January. So there's also a Medicare Advantage plan. Open enrollment runs the first 3 months of the calendar year, January through March. If you're enrolled in a Medicare Advantage plan, you can switch to a different Advantage plan or switch to original Medicare and join a separate Medicare drug plan. So those are some opportunities there where you can make changes. You want to review annual notices of changes. We've talked about that every fall. Medicare Advantage plans and drug plans are required by law to send out notices of any changes in their formulary or in their price structure to allow people time to make decisions on reviewing those changes and see if they want to make changes. Every year, Medicare mails out one to all Medicare beneficiaries, one per household anyway, a very valuable tool called Medicare and You Handbook that has excellent, just a world of information about Medicare and what it covers. And then if you're looking at Medicare Advantage plans, you want to compare and shop. I know in North Carolina, there are a large number of companies that offer even a larger number of plans. Many companies offer multiple plans, so there's an awful lot of plans to look at and to compare and shop with. And then finally, every community, every county just in North Carolina has a senior health insurance office, and they have counselors there that can help you with questions that you might have about Medicare, and many times they can assist you in comparing plans and trying to help you figure out what's best for you. So you want to take advantage of those sources, those tools as well. There are special enrollment periods we talked about where people certain events happen in their life, such as they move or they lose coverage. Medicare, there's a whole list of special enrollment periods that people can qualify for. But these are two main ones: moving and losing coverage, where you can apply for Medicare. Transitioning from employer-sponsored coverage, if you're eligible for Medicare, you can do that without penalty. And as I said, there's a whole list of other special enrollment periods that exist to help people that under certain circumstances. This third topic, Medicare fraud, it's important to realize that there are opportunities out there where we can protect ourselves. Medicare fraud is a challenge for Medicare. It's a challenge to so many industries, certainly the healthcare industry, not just Medicare. Some of the things that we urge people to do is, to protect their Medicare card. Don't leave it laying around where people can see it and copy their Medicare claim number down or their name. So you want to protect that card. Also realize that Medicare will not contact you and ask for personal information. The number of people that have told me that people have called them, they've gotten calls from people proclaiming to be Medicare representatives. Just realize that Medicare is not going to call you unless you've asked them to call you. You've spoken with them. They're going to call. They're not going to try to sell you anything either. So just keep that in mind. But the one big thing you can do to help you protect yourself and Medicare every time they process claims, they send out Medicare summary notices. You want to check that notice for fraud, billing fraud, or any kind of healthcare fraud, like there's a service on there you don't recognize that hey, that doesn't apply to me. You should call Medicare right away and bring that to their attention. They will work with you. So there are things that you can do to protect yourself, which is so important, and also important to Medicare.
And Pat, just before you
Yes.
go on here, we want to make sure we have enough time for questions at the end. So I wanted to let you know that we're going to move into questions and answers soon.
Okay. Let me do these two slides. I'll be done. Resources. The number one resource that you should become familiar with is Medicare.gov, and then it's online. World of information. We use it all the time to help people, guide people there. And the state health insurance assistance programs, SHIP, I've talked about that a moment there. Each county has representatives that they're available. And that's true just about any state. And then finally, AARP has several really good Medicare and Medicare enrollment information guidelines and resources. The most popular is the AARP Medicare Enrollment Guide, one on the left of my screen. That's an interactive tool that you can use with sitting down with someone who goes through much of the same information we have reviewed. And then finally, Medicare Made Easy, AARP guide there. So here we are with, these are the topics that we addressed. I know it's a lot of content, a lot of information, and it's probably scrambled a little bit in your own mind. I can understand that, but I appreciate you being here and letting me be part of this. And I'll open it up, Kiana, to questions, whatever time we have left.
And so at this time, if you have any questions, feel free to unmute yourself. Any questions? Nope, I'm seeing some shaking of the heads here. So, okay, no questions. All right. Well, if you think of some questions later, oh, go ahead, Pat. I see you were going to
Well,
say
I just
something.
wanted, I wanted to say that I realize that to cover all of this in this amount of time is quite a challenge, even for people that have a little bit of a working knowledge of Medicare. And Ken, I'd like to repeat to you, if there are folks that are here that feel free to pass my information on to them, my contact information. If they've got specific questions about anything we've covered or anything related to Medicare, I'll be glad to contact them. I'm a certified counselor. Whatever we do is confidential. I treat it as confidentially, and I'll try to help them with any issues or questions that they have, or at least, if I can't, we'll find the answer together because I know where to go to get answers, and so I'll just make that available to them through you.
Yeah, thank you. And Stephanie says, thank you so much for everything. Very enlightening. And she said, thanks, Pat.
Thank you. Y'all have a wonderful day.
Yes, thank you all for joining us today. This session will be available on YouTube. And again, if you have any questions later on, feel free to reach out to me and I'll connect you with Pat here. But again, thank you all. Thank you, Pat, for this amazing presentation and all the good information. I hope you all enjoy the rest of your Wednesday.
Goodbye.